Welcome back to Showcase Pittsburgh on KDKA-TV. I'm John Klein. Today, 8 businesses. Mark Miller will be back from Treasure Hunt, Dr. Nathan Lockery from Aspen Dental, and Brad Grantham from New Image Hair Clinic. But right now, Danielle Bodner back again from Life Pittsburgh. Welcome back.
Well, thank you.
In case somebody's watching right now and they haven't watched before, maybe they've seen your vans. I see that Life Pittsburgh van. I hope you have a bunch of vans because it seems like they're everywhere. What is Life Pittsburgh?
Life Pittsburgh is living independence for the elderly. The whole goal is to keep somebody in their home setting. This is a program for those individuals who might be on the verge of going into a nursing home but really want to stay in their home. And we provide all of the services that would do so. We are a medical insurance plan, but we are so much more than that.
Is it something where do you work with different hospitals and different organizations and you kind of network information together?
We sure do. We receive referrals from discharge planners at hospitals, social workers, any community advocacy programs are really looking for our program to provide their individuals that they see on a daily basis with services that they might need.
Well, I'm glad you're on because I'm going through this right. I was telling you before we got started, my dad had just gotten out of the hospital.
Yep.
Hi, Dad. I'm sure he's watching too. But it was stressful because he's 88,
Yep.
and when he was released from the hospital, it's like, okay, do this, do this, do this, and if you have any questions, go online.
Right.
And all of a sudden, it's confusing, and I'm guessing that a lot of seniors, when they're released, they don't know how to communicate with a doctor, or they can't go through these endless forms and they're not using the web.
Right, exactly. And that's where this program, that is the biggest benefit of this program. It's all about that coordination of care, integrating all of those pieces together. So we have a doctor on site, we have nurses, social workers, dietitians, physical and occupational therapists that are all working with that individual to come up with a plan that is going to best meet their needs.
And I'm guessing that, and again, we just went through this, and it's so frustrating because you can't get an appointment with this doctor until you see this doctor.
Right.
But you need to, and you need somebody to help you out.
You do, and we actually take it one step further than that. We're actually the ones who are calling those appointments. So we're calling and scheduling those doctor's appointments. We're providing transportation for them to get there. And then we're getting all that information back to know what the step or what the next step is so nothing is mixed in their medical care.
What is the staff to patient ratio? I know before you said it was pretty high.
It is. It's really nice. We have over 400 participants currently across 4 centers. So it leads to a very easy access to your care. So no appointments are needed. The individuals have an emergency number where they can call, and if they need to see the doctor, we can get them in that day to see the doctor.
That quickly?
That quickly.
That quick, because that's an obstacle too, where most people, it takes a week or two, and you get frustrated.
You do, yes.
Why are you guys more proactive than other programs? Because I know other companies try to do this, but you guys are really out there.
Well, that's our whole goal. It's all about that coordination of care. We have eyes on these individuals every single day. We can notice if there's any change in their wellness. So, you know, we're looking at them. All of our team is doing various assessments, and we're able to put services in place immediately if there's anything that's going on.
And this is a team approach. So this is not just one person as your caseworker.
Right.
You have a team of people helping.
We do. Every morning, that entire team meets to talk about any participant on the program. So that's including the doctor, the nurses, the social worker, the dietitian, physical and occupational therapist. Again, are meeting every day, and everybody on that team knows that individual and is able to make their recommendations as what's going to meet their care.
What does this cost?
It's absolutely free.
Free?
Free.
Nothing?
Nothing, as long as an individual qualifies financially for the program.
Before we sign off today, you always have a message. What would you like to leave everybody with?
Really, please call us. Do not wait for that crisis to happen. The goal is to keep individuals in their home, living their life fully and with quality, but those individuals that need our supports, that's where we can really help.
And I'm assuming too that's a scary situation where somebody's a senior and they don't want to leave their house and they don't have an option and they don't know who to turn to, or maybe their adult children are in another city or another town, and it's frustrating and nobody can get together on this.
Right, and that's where we come in. We take a lot of the stressors off that caregiver, and we're making life just a little bit easier for the individual. You know, we're helping schedule all their doctor's appointments, making sure they have all their medications, taking them appropriately, using the right assistive device, so everything is coordinated for them and just making things easy.
Sounds like a plan. If you'd like to know more, you can call Danielle at Life Pittsburgh, 412-388-8042, or log on to lifepittsburgh.org. If you want to be on our show, call us at 412-575-2400 or email at showcase@kdka.com. Mark Miller from Treasure Hunt Coins is on the way next when Showcase Pittsburgh continues.